Now, the NHS Volunteering Scheme is the most incredible way that you can give back to your community. You can volunteer if you're under 70, if you're not pregnant, and if you're in good health, and of course, if you don't exhibit symptoms of coronavirus. And this is about supporting the NHS, helping out with non-medical duties. So essentially things like making sure that elderly people aren't left alone and isolated, ensuring that people get the shopping that they need if they are in isolation. It's an amazing way to give back to your community, and already 400,000 people have signed up. So please have a look at it and sign up for the NHS Volunteering Scheme. My colleagues in the front line in the NHS are obviously overstretched at the moment, and of course we are just at the beginning of the rise of this curve. I think many doctors and nurses are concerned about what could be around the corner, but the most important thing that you can do to help is to stay at home. Ensure that you socially isolate, and that means that we can flatten the curve and reduce the number of people who are getting the infections. Now, if you do have to go out, if you have to go shopping, for example, then make sure that you maintain that social distancing. Make sure you stay at least 2 meters apart from other people that you come into contact with. And when you do get home, make sure that you wash your hands thoroughly for at least 20 seconds. If any of you in the household exhibit symptoms, then you need to self-isolate for 14 days. But if you live alone and you exhibit symptoms, then you need to self-isolate for 7 days. The government is facing an unprecedented challenge. This is a global pandemic, and we are learning very quickly more and more about this virus. The government is now making sure that a lot of PPE, personal protective equipment, is being sent out to the front line with the help of the army. And it's vital that our doctors and nurses and care workers are protected in fighting this disease. There's also a lot of work going on about testing. At the moment, we can only use antigen testing. That means that we take a swab from your nose and we look to see whether you have active virus. And those tests are being ramped up. But the gold standard would be to have an antibody test. And that is a test to show whether you have had the virus in the past. Now, at the moment, those tests simply aren't good enough, and we are now evaluating the ones the government have just bought. But if we can get an antibody test that works really well with high sensitivity and high specificity, and that means that it's very, very accurate, then it means that if you have had the virus in the past, you can be released. You can go back to work, you can start looking after those people who are more vulnerable. And it is worth pointing out that there are 1.5 million people who are at high risk of this disease. For most people, 80%, they will have a mild self-limiting illness. But those people who are over 60, those with chronic diseases, particularly lung disease and heart disease, those with diabetes or immunosuppression, are at high risk. And that is why the government have asked those 1.5 million people to self-isolate. So now we need to rally round and ensure, through the NHS Volunteering Scheme, that those elderly people, those vulnerable people, are looked after. They've been at home alone for 5 days. This could last for many, many weeks, and it's really important they feel that they are being supported and they are not alone. And of course, finally, the Prime Minister has just tested positive for coronavirus, as has Matt Hancock. I think it's worth saying again that 80% of people will have a mild self-limiting illness. But what this shows more than anything is this virus doesn't discriminate. You can be rich, you can be poor. It doesn't matter. The most important thing is we protect ourselves and our families. And I want to repeat, you need to stay at home, self-isolate, and make sure you wash your hands for at least 20 seconds. It's really important. And that way we can flatten the curve and make sure that we beat this epidemic.